Hello.
Hello, doctor. I'm Bartesh from HealthWish. Thank you very much for accepting my invite.
Hello, Mr. Vartish. Nice to connect with you in this platform.
Same here, doctor. Doctor, my
Yeah.
first question to you would be, what is hysteroscopy?
Okay. Hysteroscopy, it's a diagnostic test. Like it's a test that is done to diagnose whether there is any problem. What we do is we check inside of the uterus. We also call it as a uterine cavity. The hysteroscope is a thin instrument. It's around 3 millimeter diameter instrument. You can imagine how thin it is. So we pass this instrument inside the uterus through the cervix. We check the cavity of the uterus through this instrument. The end of this instrument, we call it as a hysteroscope. The end of this hysteroscope is brightly illuminated.
Okay.
And this instrument has a camera attachment also, and we check for the display. It is displayed in a magnified screen. So any problem inside the uterine cavity is magnified and shown to us, and that is what we check on the screen to see whether there is any problem inside the uterine cavity. This is the basis of hysteroscopy.
Okay. Doctor, also, what is the role of hysteroscopy in IVF?
Okay. Actually, before IVF, most of us do hysteroscopy to check inside the uterine cavity, as I have told, because in IVF, what we do, we prepare the embryo in the lab, in the ART lab, that is assisted reproductive technology. In this procedure, we prepare the embryo, and that embryo we place finally inside the mother's womb, that is the uterine cavity. If we have not checked the uterine cavity, that is the womb, how it is, in the sense if there is already any problem like fibroid, polyp, some kind of growth, some additions or some partition also we call it as septum. Suppose any such things are there and we have not checked that part and we directly place this fertilized embryo there, that's not right? Because if it is done, so definitely it will fail. These lesions, what I have told already, fibroid or polyp, etc., if they are there, they will definitely hinder the pregnancy to happen. If the endometrium, that is the inner layer of the uterine cavity, will not be very friendly or very conducive for this embryo when such problems are already there. So we have to correct this problem and see that uterine cavity is very clean and clear, and then place the embryo. So I feel before IVF, doing hysteroscopy is always better.
Okay. So you mean to say it is compulsory?
I don't say it is compulsory. It is better. It is experience varies from doctor to doctor. Some doctors, what they do, if the ultrasound, that is the 2D, two-dimension ultrasound, 3D ultrasound or MRI, if these high-end investigations are normal, they forego hysteroscopy. They don't do hysteroscopy. If these investigations are normal, most probably it is normal and they place the embryo. The view changes from doctor to doctor. But according to me, it is in what we do in hysteroscopy is a direct visualization of the uterine cavity. We see with our eyes. So nothing like that. That make very sure that it is very clear and then place the embryo. It is not very compulsory according to some of them, but according to me, it is a preferred way of doing ART techniques.
Okay. Doctor, I would like to hear your message to HealthWish listeners.
My message to HealthWish listeners would be, you can try for pregnancy when you are newly married. And the message goes to the couple that for 1 year you can try on your own for pregnancy, maximum 1.5 to 2 years. But by that time, if one does not get pregnant, it is definitely better to visit the gynecologist, because the age of the woman gets older faster. After age of 30, 32, it becomes more difficult for the pregnancy to happen. So wait for maximum 2 years for spontaneous pregnancy. If it does not happen, definitely visit the doctor so that you try to get pregnant or hasten that process. That's what I would like to say to the listeners.
Okay. Thank you very much for your time and look forward for more such conversation with you, doctor.
Yeah, definitely. Same thing from here side. Thanks, Mr. Vartish, for this opportunity.
Thank you so much, Doctor.
Yeah, thank you.